So my name is Bridget, and I became a doula actually a couple of years ago, and this was prompted by my own personal experience. So I had my first child during the pandemic, and as you know, during that time, you were not allowed to have anybody, but the laws changed, and you were allowed one person. I knew that I needed somebody that was reliable and knew what they were going to do. So I was lucky enough to get a doula who actually did this pro bono for me, a huge blessing. What I noticed is, though for years and years and years of dreaming of becoming a mom, I was not as ready and prepared as I was. And then you add that component of we're living in a stressful time, my body's changing. It was a blessing. So, what now as a doula, I tend to offer a few things. I offer emotional support, physical support. I'm sorry, she wants to become a doula too. I offer informational support, advocate, and I also work with the family, not just the pregnant individual. When I'm offering emotional support, I try to be present from early onset of labor till birth or even postpartum. I usually work by encouraging my birthing people. I have by boost their confidence and morale, because sometimes that's all you need. You need somebody by your side to encourage you, and you need a lot of empathy because, as you know, when you're pregnant, everybody has an opinion. From the neighbor to the person walking their dog, everybody knows everything about you. And sometimes they just touch you. So as a doula, I empathy listen to my mother's feelings or their partners, and I create a safe space for them where they can express concerns and emotion and how to deal with the various people in their lives. What I also do is I offer physical support and different techniques to alleviate discomfort. That can be something like a breathing treatment, massage, different ways to position yourself. And assisting them how to do that as labor progresses and comfort. When I'm doing this physical support, I also work with their partner, whoever they choose to have in their birthing room, in case for some reason I don't make it in time. And we work together and we learn different techniques, right? If they decide that they're going through a water birth, I offer support on how to utilize water to provide relief. Okay. Informational support. I I try to keep myself educated. So I read a lot about birth, about babies, about new research coming up, and I provide that information to my birthing people. And we talk about all stages of labor, common procedures and interventions. And I empower parents to make their decision. Because again, I am not a medical professional and I am not going to replace a doctor or their medical team. I'm here just as an additional person. If they go to their postpartum, if they go to their prenatal appointment and there's something that they do not understand, I work with you. I explain to you what that means and what the possible intervention is. But I also, as a doula, do not take any decisions for you. That's something that you make on your own, okay? Because this is your birthing experience, and I want to keep it as that. My goal again is to just be purely supportive. There's no right way or wrong way to go into birth, right? Advocacy. This is a big chunk and it's one of my favorites. It's I keep an open dialogue with mom, the partner, the medical team, and just to make sure that we work together. I do not want anybody to feel like I'm imposing my way or I'm not listening. But if for any reason my birthing person is feeling not respected or they just don't understand something or they're lacking of something in their home, in their community, I will jump in. What Flourish Care does that is amazing is there's a whole team I can reach out to and say, okay, mom has problems getting to the hospital. Mom has problems making to her an appointment. Flourish will jump in and find those resources. They'll call the insurance. For example, myself has PT1 and they'll coordinate with PT1 to make sure that mom can make herself can go to her appointments, right? And if they say something like right now, I have a family she's going to give birth in October, and Flourish is actually trying to look at options for where would her dad stay, because she's the main caregiver, right? So it's very open what I do. It's a lot of fun. It's just not going to the hospital and giving birth. It's just a whole spectrum of care that I try to order. And I find that having a doula, one, reduces stress, and it also reduces intervention. My favorite phrase is, if it's not really medically urgent, can we wait on it, right? But again, I can't make that decision for any birthing people. They need to be able to make their decisions. They need to be able to advocate for themselves. I can give them the knowledge that I know, and they go with whatever they need. All we want for our birthing people, moms, partners, is to have a positive birth experience, right? Because if you don't have a positive birth experience, that falls into other perinatal issues, like we mentioned before, depression, anxiety, and we want mom to be as healthy as the baby. Okay, so when working with me, for example, because I'm speaking from my experience, I love to build a relationship not only with mom, but with their whole medical team and the families, so that everybody can be on the same page, and everybody can be able to come together and support mom and welcome the new baby when time is ready. Oh gosh, sorry guys. When time is ready, right? During labor and delivery, I will typically join my birthing family either at home or at the hospital when it begins. When I come to the hospital or at home, we start thinking about, okay, let's review our birthing plan. Is everything still according to plan? Is everything still going away? Then as she progresses, as she remembers her breathing techniques, I will leave for a while, right? And I'll wait for active labor. But during that time, we're still actively in communication. And this is why it's really important for partners to know that I am not here to replace the partner. I am here to work with you as a whole, as a family. For moms who do not have partners, that's a different story. I make myself available pretty much 24/7 during that birthing period. But if you have a partner, we communicate, because it comes a time during labor when mom is so exhausted, just looking at me can be stressful. So I communicate with the partner and I remind them, like, this is the technique that we use. So it's a family affair, or it's a community affair, if I say. When we're in the hospital, I make it a point to introduce myself to the medical team, midwives, doctors, what's not, and just to let them know that I am here as a presence. What this does for the medical team as well as mom, it offers relief, because the doctor cannot be in the room 24/7. The nurse has a lot of people in her roster, so me being there as a continuous support, talking to mom, call me mom, helps the situation. Mom is more relaxed. Mom is focused on the baby and coming. If we need to sing songs, we sing songs. If we need to listen to music, we listen to music. If mom wants me to read her book, I'll read a book. It's just making sure that everything works out. Everything works out for mom, right? What I do offer again, is like, let's talk about my day. Like, what is a day in my life? What I do is I start by checking my messages from clients, and I respond to overnight questions, and offer reassurance. I make sure that I do my own personal self-care, because everybody gets burnt. You can get burnt out. So I do my own personal care. I meditate. Then I start with my client visits. I will conduct like perinatal visits. I will discuss the birthing plan, practice comfort measures with my clients, and offer education about birth, labor, and postpartum care. So this, depending on depending on any client's needs, is an hour or two, right? And as you know, I'm in Massachusetts, so myself covers this, and it's amazing. After that, I book a different appointment, and we see each other at a later time. When I'm doing my care, I also listen very attentively to what mom is telling me, and I try to determine what is the next point of action. Do I need to be, do I need to give her more time? Do I need to call somebody else on her behalf? Or everything's been fine and we just wait for the next appointment? Um, I like to say that I'm a therapist without a degree, but again, I do not practice medicine. So I make recommendation. It can be something as simple like, hey, you look stressed right now. Is there somebody you'd like to talk to? Is there somebody I can connect you to? If they don't have anybody in mind, then I reach out to Flourish again, and they have a lot of amazing resources that we then connect our clients to. If, for example, they're having an issue at home with their partner, for example, I listen, and the only way I would intervene is just to advocate for mom. But again, I do not talk to them. I do not interfere in any discord. I let them handle it themselves and make sure that everybody is safe. Okay. During labor support, this can be done at home. Most doulas work in hospitals, in birthing centers, they work at home. So it's really important to choose somebody, a doula that with whom you connect, because it's a very emotional journey and it's very personal. So you need somebody that you trust, okay? Usually we are on call. Let's say if your due date is August 3rd, I like to joke like any time between that month is full game. So as a doula, I have to be on call. I also understand that maybe I cannot be 10 places at a time, and we tend to work with the backups. So in the process, when working, especially with Flourish Care, the system is you always have a backup that can jump in. So you'll connect with your primary doula, and then eventually, when closer to your due date, we will introduce you a backup person that will just act as extra support. If you can't text me and you text the backup, they will answer as fast as possible. So there's a lot of flexibility and balance here. And we're very accountable to the people that we work with, right? Another responsibility that we carry as doula is we engage in a lot of community activities, and being with Flourish is amazing because there's so many baby showers, community baby showers. There's prenatal classes that can be offered. There's workshops that they can send you to. There's fairs. I just attended one last time with Melissa, actually. It was amazing, and I got to meet people from Family Well, PSI, who handles like perinatal mental health care. So it's very detailed, the range of support that we offer during the day. And we just want to enhance the childbirth experience for pregnant people, the partners, and the family. So what I've noticed is a lot of people don't really know what a doula is, or if they do know what a doula is, there's the misconception that we're here to replace your doctors, your midwife, or your partner. We're not going to do that. We're here to offer support, and we're here to basically work with everybody in unison, right? So when we work with a pregnant person, mom, um, or however you identify, I'm sorry, I should mention that. We offer continuous and emotional support, and we try to reduce anxiety and stress. What I like to do is breathing exercises, right? So we can learn, there's different breathing exercises. My favorite is smell the roses, blow your candle. But depending on each individual, I will tailor it. If I need to do Lamaze breathing, I will do that as well, right? All I want for my pregnant person is to feel confident, empowered during that prenatal stage, during pregnancy, during labor, and postpartum, right? So again, we're here for the whole family. Um, I do a lot of education. So I take notes a lot. I take notes a lot. And whatever is missing from my depth of knowledge, I do reach out to others that might be more experienced than I am, or that just basically know better. I can reach out to a doctor and ask for more clarification and then try to explain it in lay terms. But from the beginning to the end, we are very involved. We're also involved to the capacity that makes mom and the family comfortable. So if you're somebody that prefers communication once a week, we're there for you once a week. If you're somebody that needs communication every 2 weeks, every 2 months, we're there. We're really very flexible. During the process of birth and labor in the hospital or at home, we make sure to relieve each other. So that's why it's great to work with the partners. If dad is there or grandma is there or sister, depending on who our birthing person chooses to come with, we take turns, right? Because we can't be there for the full time. So we just take turns. But the most important thing to remember is we work with everybody. So if mom has a question, if the partner has a question, if dad has a question, we work in unison so that everybody feels heard, everybody feels ready, and we communicate well with the doctors. We delegate information as it goes. What we also do offer as doulas is we try to understand family dynamics, as I explained, and help facilitate open communication. Often partners will feel like partner, it's such a beautiful experience, but as we focus more on the baby, partners can also feel lost in the mix. So we want to remind and empower everybody in that stage that you're equally important. And I'm talking specifically here about siblings. As doulas, we work a lot with siblings and we help prepare for the arrival of a new baby in age-appropriate explanations, right? And we offer reassurance as well. Because some babies, some kids are really hilarious. I've had a kid ask me, okay, but when can we return it? So it's just creating a calm environment where everybody feels supported, mom, dad, birthing person, and we encourage bonding. I also work in the postpartum period, and this is a great time. If mom, if it's your first birth, you're maybe not ready to have a baby. You've done the baby shower, you've done everything, but there's so many questions that come in the perinatal period. We help by being there for you and also like looking for signs of like, oh, is this anxiety turning into something different? Is it time to refer you to someone else? Just to make sure that you have that healthy mind. Because as we mentioned in the US, we really have poor preparation for moms and birthing people after they've given birth. Some people have to return to work right away because maybe they're a single mom and they need that income. So being able to let them know what options they have, especially let's say they want to breastfeed, but breastfeeding is challenging, then we work with Flourish to find that lactation specialist, somebody that can come in and take the pressure off and just assist you as you go and as you learn the process of being a parent. So as a doula, we're not here to replace anybody. We're here to be an additional team member, a coach, a friend, and hopefully somebody who makes your birthing experience better. Thank you.